We are back with more of what's now rounding out our show all about your health with COPD. I recently spoke with Dr. Frank Trudo about a survey that was done that mentions that people are not talking enough about this disease. Here's more.
This time of year will be unlike any other for millions of Americans with chronic breathing issues. And if you have COPD, which stands for chronic obstructive pulmonary disease, there are even more hurdles to jump beyond concern over the pandemic and flu season. A recent survey finds doctors and patients aren't talking candidly enough about how to best manage the disease. Here now are pulmonologist Dr. Frank Trudo, Vice President of U.S. Medical Affairs, Respiratory and Immunology, and Kristen Willard, Vice President of Public and Professional Education at the COPD Foundation. Thank you so much, both of you, for being here today.
Thank you.
Thank you.
Dr. Trudo, can you start by telling us a little bit more about COPD and what we should know?
Yeah, absolutely. COPD is a common, preventable, and treatable lung disease. Common symptoms include coughing, shortness of breath, and the production of mucus. Patients with COPD can also experience flare-ups, or what we call exacerbations. A flare-up is a worsening of day-to-day symptoms that need different treatments, and they can also lead to hospitalization. Now, what's important to know about flare-ups is that they can lead to a loss of lung function, and having a flare-up increases your risk of having a future flare-up. Nearly 16 million Americans are diagnosed with COPD, yet millions more are not yet diagnosed. So in order to detect COPD sooner, it's so important to report any respiratory symptoms you may be experiencing to your healthcare provider.
Kristen, can you tell us more about the survey and what you found?
Sure, absolutely. So as you can guess from what Frank is saying, a key component in reducing the risk of these exacerbations, or as we just said, more commonly called flare-ups, a key component is this open door, helpful two-way communication between a physician or a healthcare team and patients with COPD. So at the foundation, this is something we're really interested in. So what we did was we worked with CHEST, and with support from AstraZeneca, we put 2 surveys out into the field, one for doctors who care for people with COPD, another for patients with COPD. And we asked them a variety of questions, everything from, are you using a COPD action plan, which is really a roadmap to help you with your exacerbations, to who starts the conversation about exacerbations. And what we found was really illuminating, really eye-opening, that there are these gaps in perception, in actions that people are taking, and just in general in how these conversations are being held. So let me give you an idea of the results of one of these. So we found that approximately 7 out of 10 people with COPD that we surveyed remember that their doctor said to them, come to me when you have a change in symptoms, don't wait, I want to hear from you. But only 2 out of 10 patients that we surveyed actually went to their doctor, reached out whenever they noticed that change in symptoms. So this is just one example of the many gaps that we found, but we're here to help people to understand that we can address those gaps.
And Dr. Trudo, why do you think that this gap exists between patients with COPD and their healthcare teams?
Yeah, so symptoms of COPD flare-ups may be underreported for a variety of reasons. Patients and healthcare providers may not be effectively communicating about early changes in symptoms that may indicate the onset of a flare-up. So communication is key in reporting any changes in symptoms as well as the impact that COPD has on daily life. Now, in addition, an increase in the use of tools like action plans can help to more proactively identify these early changes in symptoms and facilitate that communication between patients with COPD and the entire healthcare team.
And Kristen, what should be done to help address this communication gap between patients with COPD and their healthcare teams?
Thank you for asking that. I think there are so many things that can be done. So I want people with COPD and their healthcare professionals to hear that there are things that we can do to address these gaps. I think if you are a patient, remember to reach out to your physician. Do not hesitate, do not wait. Don't also chalk up the symptoms that you're having, if they get worse, don't chalk them up to a cold or to allergies. Go ahead and report them to your healthcare team, and then that team can make the decision about what to do next. I think something else you can do as a person with COPD, make sure that you understand exactly what flare-ups look like for you. They're different from person to person. Try to understand or to track what might trigger or be related to your exacerbations or your flare-ups. And also, I think one of the most important things you can do is work on a written action plan with your doctor. So this will help you to understand, okay, what symptoms am I watching out for, and what do I do when those change? And one of the things that you can do in order to move that process forward is to start by downloading an action plan from the COPD Foundation website. At the site I'm about to give you, you can also find the full results of this study that we're talking about today. And that website is COPD Flare-Ups, and that's plural, so it's UPS, copdflareups.org.
And Dr. Trudo, anything else we need to know about COPD and this survey?
Yeah, absolutely. So remember, communication is key, particularly about any changes in symptoms. You can learn more about COPD and flare-ups by visiting listentoyourlungs.com.
Will do. Thank you so much, Dr. Frank Trudo from AstraZeneca and Kristen Willard from the COPD Foundation for joining us here on Park City Television today.
Thank you.
Thank you so much.
That's it for this episode of What's Now All About Your Health. Be sure to tune into Park City Television every day live at 8 a.m. We have our show Mountain Connections, where we focus on the community. We inspire and educate our audiences. And if it's important to you, it's important to Park City TV. I'm your host, Christine Napier, and I'll see you next time.